This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome to Decoding Dentine Discussions, the podcast where we delve into the latest developments and best practices in the field of dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and today we've got a fascinating episode lined up, Conquering Dentine Hypersensitivity, Tools and Treatment. Today we're very lucky to have Dr. Ebrahim Patel join us. Dr. Ebrahim is the clinical manager of the Wits Dental Hospital, a tertiary academic facility of the Gauteng Department of Health, serving as a clinical training platform for the School of Oral Health Sciences at the University of the Witwatersrand, South Africa. He is also an endodontic consultant at the Think Clinic and a member of the South African Dental Association. Together, we'll be revising the mechanisms behind dentine hypersensitivity, exploring how it works, and delving into the science and mode of action behind current treatments for managing it. Before we start with the whole session, Dr. Ebrahim, I'd just like you to tell us a bit more about yourself, what you do also maybe outside of dentistry.
Hi, everyone. It is a pleasure to be here today. So as mentioned, I'm Dr. Ebrahim Patel from South Africa, born and raised here in Johannesburg. It becomes difficult to talk outside of dentistry because I feel dentistry becomes your life at some point. But apart from that, I have a lovely family, a wife and 3 kids, and really all my spare time is being a kid with them. And that's how life goes by.
That sounds awesome, being a kid. I think we need to be a kid outside of dentistry, correct?
Absolutely.
This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne with Novomin builds an occlusive layer from the first use that is resistant against dietary acidic challenges and maintained after repeated acidic challenges. So before I start asking you questions, I just want to give a bit of a preamble. In June 2024, Halion and CAP hosted an international advisory board focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we're exploring the key outcomes and clinical insights from that event, offering practical advice and evidence-based approaches to improve patient care. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. We've had lots of episodes prior to today where we've discussed the management, the etiology, how to make sure we diagnose dentine hypersensitivity correctly. We've talked about other conditions that can mimic dentine hypersensitivity. So we're going to do a little bit of revision and also talk about strategies. So my first question to you is, what dentine hypersensitivity management strategies are available?
So, Shaista, I think this is becoming a more important question in that even in practice, in an endodontic practice, we find more and more patients coming through with dentine hypersensitivity. And so it has become very important to really investigate and outline what is the best strategy to follow. So we follow a step-up escalation approach when treating dentine hypersensitivity. And really, we identify 3 key spheres. Firstly, as always, patient education, which includes your dietary assessment and then modifying that diet, your lifestyle assessment and any changes required on that end, an assessment of the oral hygiene regimen of the patient, and then guiding our patients to correct those. And that includes your brushing techniques, your flossing, and others. Mm-hmm. And lastly, also identifying any key risk or predisposing factors of the patient, such as your parafunctional habits, etc. We live in a world where stress has become part of our daily life, and parafunctional habits have definitely increased. So we find that, whilst we start with this, we then escalate to your conservative treatments, and that includes your home interventions like your desensitizing toothpaste, your fluoride mouthwashes, and so forth. And once we do that, we then review our patients a month later. We see how they're doing. And if needed, we then employ in-office tooth surface treatments. And there can be various compounds like your glutaraldehyde compounds, oxalates, fluorides, etc. But we do find that even in those cases, we sometimes need conservative or more comprehensive treatments, shall I say? And that's when we employ restorative or even surgical treatments. So this is either with direct restoration of the tooth using our composites or glass ionomers, but can also escalate to surgical periodontal therapies as an absolute last resort is then your endodontic therapies as well.
Okay. So can you explain to us the science behind some of these strategies like the desensitizing toothpaste or the fluoride mouthwashes and so forth?
Absolutely. The best way to approach any treatment in health is to use an evidence-based approach. And dentistry is no different. And so any strategy needs to be backed with supporting literature. By understanding the etiology of the dentine hypersensitivity, we then appreciate the impact of the patient-specific behaviors on the oral environment and can implement a unique approach to reduce the factors that lead to dentine exposure and then the sequelae of the dentine hypersensitivity. So some strategies are straightforward, for example, like placing a restoration over exposed dentine. That will physically seal the space and give you a result immediately. But when we consider our desensitizing agents, such as our toothpaste, we need to understand the science behind the impact so that we can modify our approach when necessary. So for dentine hypersensitivity, the main mechanisms of action of our toothpaste would be either to occlude those dental tubules, completely seal them, or we use protein precipitation, and sometimes we also utilize agents that desensitize the nerve in the space. And that's how we approach this here.
So you've been talking about dentifrices, toothpaste. So, I'm hoping that it's not just dental colleagues that listen to this. I'm hoping, people that are suffering from dentine hypersensitivity also listen to this podcast. What ingredients are currently used in toothpaste, and what is it that people should be looking out for to help them with dentine hypersensitivity?
Yeah, so I find that this is a very common question that my patients ask. They'll go into a pharmacy, they'll go into a store, they'll see a shelf full of toothpaste, and they won't know what to choose. They find the words are sometimes confusing. Their dentist may have advised them on a toothpaste, but by the time they've gotten to the store, they've forgotten the name. True. So really, from our side, the advice of using these desensitizing toothpaste for the patient is that they are non-invasive, they're relatively inexpensive, and they are an efficient method to reduce and control the sensitivity. When they are looking at the compounds within these toothpastes, we often educate our patients and even our oral health professionals on what the mechanism of action is of every compound so that they understand the type of approach that they will also be guiding the patient on. So, for example, we have our potassium compounds, and these can be in the form of potassium nitrate or chloride or potassium citrate. And what this does is that this depolarizes the nerve synapse and disrupts the conduction of pain impulses, easing the sensitivity. So this approach is used not to occlude the tubules, but just to decrease the sensitivity from the nerve. Other compounds are then your stannous fluoride, and that works with insoluble metal compounds within the area. So what it does is that it binds to tin or fluoride, and that then blocks the open dentinal tubules. So this then looks more towards occluding the tubules to decrease that sensitivity. You do get other compounds like your arginine and your calcium carbonate formulations, and those work with your glycoproteins within the body, and they then also, it kind of occludes the tubules as well. But one of my favorites more recently, and perhaps I'm biased being an endodontist, we are working a lot more with bioceramics recently and really seeing the benefits of these bioceramics within the root canal system. And so I was very excited when we heard about the calcium sodium phosphosilicates, which are now available in our toothpastes. These are your inorganic, your amorphous bioactive materials. And what I like about it is that they are elements naturally occurring in the body chemistry. And so as part of that, what the bioactive glass ceramics do is that they combine with the dentine due to their high affinity with collagen, and they then emit calcium and phosphate when exposed to saliva. This really gives us a really good desensitizing effect because we have the creation of a protective hydroxyapatite. So unlike our previous compounds, which were either just desensitizing the nerve or blocking the tubules, which could be removed after, this is forming a natural structure to block the area. So I'm appreciating these more recently,
Okay, amazing. I mean, I do think bioceramics are amazing, and I'm glad you mentioned the calcium sodium phosphosilicate, which is a bit of a mouthful. I think we all know it as Novamin, and this is in Sensodyne have released a recent toothpaste, and this contains it. And this is something I've been recommending patients a lot, and been getting really positive feedback from patients about this. Have you had any experience with patient feedback about the use of these toothpastes?
Yes, absolutely. I think it comes to the guidance with our patients of how to utilize these toothpastes and what they'll experience over the first few weeks of using these toothpastes. And I've been fairly impressed in that, we have been advising our patients for a long time on the use of toothpaste and how they can work. But I find that when it comes to the Novamin technology in Sensodyne, I can almost quantify this for my patient to say that within 2 weeks, you are going to see the reduction in the hypersensitivity. You're going to feel it. And within a month, we're going to get you comfortable. So that whilst using the toothpaste, you're going to be fine. It's going to help. Before, I wasn't as confident because I wasn't always sure whether the desensitizing effect, how it's going to work for that specific patient. But I think having an in-depth understanding now of exactly what is going on at a molecular level, we can reassure our patients of its effectiveness.
Okay, thank you. Thank you for that. So I'm going to give you some myths around dentine hypersensitivity management. They could be true, they could be false. I want you to tell me what they are and explain to me why they're true or false. So the first one I will give to you is the statement, sensitivity will always go away on its own.
So this myth is unfortunately false. And I say unfortunately because I think we live in a world where people are hopeful that if something's troubling them, it will go away on its own and they don't have to consult a professional. The thing is that while some individuals may experience a decrease in sensitivity over time, many of them will ultimately require intervention to manage their symptoms effectively.
True. Your next myth is good oral hygiene reduces sensitivity.
So, I think good oral hygiene reduces a lot of things. So, maintaining good oral hygiene, it really does prevent the gum recession and the tooth decay. And we know that those are our main contributors to our sensitivity. So yes, please maintain the good oral hygiene.
True. Okay, next myth, whitening products cause permanent sensitivity.
So this again is something that's commonly asked, and no, this is false. So our whitening products at times can cause some sensitivity for our patients, but this sensitivity is temporary. The important thing is to use the products correctly and with proper care, and this will then prevent that.
Okay, your next myth is all sensitivity is due to gum recession.
So again, this is not correct. Yes, gum recession is a common cause for sensitivity, but we do have other causes, other factors like your enamel erosion, your dental caries or tooth decay, cracked teeth. So there are definitely other causes for sensitivity as well.
Okay. Let's see. Fluoride treatments can provide relief from dentine hypersensitivity.
So this one is kind of a seesaw myth because it can be both true and false, where professional fluoride treatments most definitely strengthen the enamel and reduce sensitivity, and that is because they provide a protective layer over the exposed dentine. But sometimes just using a fluoride toothpaste alone, no, that's not going to reduce the sensitivity. And that's why we recommend products like the Sensodyne to then assist with decreasing the sensitivity.
Very true. Desensitizing toothpaste help reduce sensitivity.
Yeah, I think if you asked me this question 5 years ago, I would have been on the fence. But
now you've got data. Now you've got.
Now I've got my patients as proof of having a product that really does work to decrease sensitivity, and it's really about quality of life. When someone tells you that they can't drink something cold with their family, that they can't enjoy ice cream, I mean, it's really something that you want to help someone with.
Well, sometimes I wonder, do we want to help them eat ice cream?
Wow.
Do we want them to have fizzy drinks,
Well, not the fizzy drinks, but the ice cream is surely not all that bad. You see, this is why good oral hygiene.
True, absolutely true. So my next statement is using hard bristled brushes is better. True or false?
So this one, so absolutely false. And it is something that we find so common, where hard bristle brushes actually exacerbate the sensitivity in that they cause more enamel wear or even gum recession. So this is where we always advise our patients on either a medium or soft bristled brush. Stay away from the hard bristle brushes.
Okay. And last but not least, home remedies are always effective.
So yeah, this one again, so it's mostly false, and it's because of the way in which a lot of home remedies are used. So some remedies like your baking soda or your vinegar, you find that can irritate the gum and enamel rather than actually providing relief. So it really does depend on the type of home remedy, but I would advise patients, rather speak to your oral health professional about it. Stay away from YouTube videos and TikTok because those can be very dangerous.
Yeah. No, they should definitely discuss it with their oral health care provider and see what is the best. I mean, even something simple like, I don't know if you agree, using an electric toothbrush, this is not something that suits all, right? Things like this, they must discuss, they must check with their dentist, whether this is an effective tool for them to use or not, right?
Yeah, absolutely. I mean, the minute you're using something electric, it's going to be switched on and working, regardless of what you're doing in the space. So if you are using it incorrectly, you can do a lot of damage.
Exactly. So we're going to start talking about, invasive and non-invasive methods available to us to help manage dentine hypersensitivity. So if you could, first of all, just brief us on what invasive and non-invasive methods are available.
Okay, sure. So, I mentioned before that we follow a systematic step-up approach to treating dentine hypersensitivity. And
Correct.
whilst we start with the conservative at-home treatments, for some cases it does become necessary to consider and employ the more invasive approaches to assist. So I'm going to take you through it and list these approaches as I go on, right?
Perfect.
So we start with assessing the patient's dietary and oral hygiene habits. And any approach that we are going to use is dependent on compliance from our patient. So the toothbrushing technique in particular must be corrected from the very beginning, as this is a strong factor that affects the success of our conservative treatments. I cannot emphasize that point enough. We then find that when lifestyle modification and the use of a desensitizing toothpaste is not sufficient, we do then have to escalate to our in-office treatments. So these include the application of your surface compounds, and these are your professional fluorides, your oxalate compounds, your glutaldehyde methacrylate formulations. And what these do is that these assist with the chemical occlusion of the dental tubules. That's probably your most conservative in-office treatment. If these don't assist, we then need to go one step higher to escalate procedures that will then physically occlude the tubules. And this is when we consider your restorations, using your glass ionomers or your composites or even your dentine bonding agents to then seal off those areas. And if it's still not completely successful, that's when you then step up to a more invasive approach. And the two main invasive approaches is then your periodontal surgery, where you are, physically moving the soft tissue to cover the exposed root surface, or as an absolute last resort, your endodontic therapy, which effectively devitalizes your tooth.
So, in your answer right now, there's been a big emphasis on, I feel, on educating the patient, whether it's about how their brushing technique, lifestyle modification, using over-the-counter products, toothpaste, and so on. And, bearing in mind your place of work, how easy is it to educate patients? And I'm sure you supervise a lot of students, undergraduates. How easy has it been for you to educate your undergraduates and get them to, educate patients?
So, the first step for me was that I first needed to highlight the condition of dentine hypersensitivity, where dentine hypersensitivity is not a clear-cut diagnosis like your dental caries, your tooth decay, where you can see a physical cavity within a tooth. And that's why it also becomes difficult for patients at times to really pinpoint what is troubling them. So once we highlight the condition to our students and even our patients, we then take them through how to treat it. And the reason why we focus so much on our patient education, and I think this comes from an endodontic perspective as well, it doesn't matter how good of a root canal you do if the mouth is not kept in optimal condition. And this is the same for your dentine hypersensitivity. The home interventions are only going to work if the patient is committed to utilizing a regimen that's going to assist to desensitize, the tooth.
Yeah.
And so if we can train our students from the very beginning to recognize the sensitivity and guide their patients, because it really is guidance and facilitation. You can't force someone. So we guide our patients on how to correct it. That is how we then can really, step by step, global change. Yeah.
So so considering, we're covering the Middle East and Africa region, so you're based in South Africa, how receptive are patients to this information and guidance?
So,
and actually another question as well. Do you find there's a generational difference? Like, are older patients more stubborn about following things and the younger generations better, or is it vice versa?
I find that more recently people are more open to education. There's so much more education available out there. Many times when patients come into the surgery, they've already Googled their symptoms. They're coming in with their own differential diagnosis of what they think is going on. And so when you guide them, I think they are a little more receptive to what you're explaining. And when you mention the sensitivity, they have already been exposed to some kind of social media around sensitivity, so they can appreciate what you're explaining to them and how the approaches are working. And I do feel we work in a time where knowledge is power. So if the patient themselves, if they understand what is going on and why you are, something as simple as, why are you prescribing this toothpaste for me? How is this different to what I'm using right now? If they understand that mechanism, they're a lot more willing to comply with you, because it's more of a partnership between you and your patient. It's not the old model where the doctor prescribes and the patient listens.
True.
Now it's a long-term partnership between you and your patient to get them into the healthiest state that they can possibly be.
Agreed. So we're just going to talk a little bit more about the invasive and non-invasive approach. If you could guide us when one is preferred over the other, and when do we have to go for an invasive approach for the management of dentine hypersensitivity?
Sure. So the first thing I would say is that every patient is unique, every situation is unique. So it is preferred to always consider your conservative approaches first. Never, go all the way to the top. You need to understand the mechanism by which each intervention works. And by having that understanding, you can then apply the correct approach for the situation that presents to you in your practice.
Agreed.
The one thing I will say is that toothpastes are part of any intervention, as your home maintenance is crucial to long-term success, whether you perform in-office treatments or not. That needs to be part of your regimen. Our in-office approaches are based on the symptoms and also the factors. Some patients will be more open to a conservative approach. They're willing to give the time that the treatment needs, and you can go through that with them. Others may be a little bit more impatient, and you may have to escalate one step higher just to provide more immediate relief while they're going through the home interventions. So it depends a lot on the patient that you have. Yeah.
Okay, thank you for that. Are there any other factors that you would consider really important?
So there are a few other things worthy of mention. First, brushing technique. I recall that, as a kid, we would have the nurses coming to our schools and they would show us how to brush our teeth. And I think it's something that we perhaps take for granted, but brushing technique plays a significant role in the development and persistence of your dentine hypersensitivity. Your aggressive brushing leads to your recession, which obviously is then the cause for the exposed tubules. And this aggression that comes is either from using an incorrect toothbrush, so the myth about the hard bristled brush, but in most cases I find that it comes from an incorrect brushing technique. And the truth really is that many of us are so caught up in our day-to-day living that we're not paying attention while brushing our teeth. So, you're brushing your teeth, but you're thinking of the 10,000 things that you have to do that day. And you find that the more stressed you are, the harder you brush, but you don't realize that. And that eventually then really causes the problem. That's sometimes compounded also by your biological factors, where if someone has a thin gingival phenotype, that is more likely to be damaged and you'll get more recession. And as you mentioned earlier, the electric toothbrushes. So electric toothbrushes and your electric water flossers, your oral irrigators, they are great. But, my one advice with them is that they require active monitoring, how you place it in the mouth, the pressure that you're going to use, the motions that you use with them. They are really, really important, because as effective as they are, they can also be quite destructive.
Yeah, so I mean, I think patients really do need to be educated about how they use the electric devices. So, quick question, out of the blue question, what is your preferred technique for brushing teeth?
So I personally like a manual toothbrush. So I use a modified Bass technique.
Yeah.
I find that for me, it is the most effective in the least amount of time. You're getting that 45-degree angle is really allowing you to get under the gingiva, clean out the space nicely. If you use that with a rolling stroke technique, you're then
Yeah.
removing all the plaque off the tooth surface. And that really is sufficient. One of the techniques I use with my kids is really just to count the number of seconds per tooth to make sure that we do spend enough time on every area. And also, by doing that per tooth, you automatically remove the scrubbing motion, because when you're scrubbing, you're doing multiple teeth at a time.
Yeah.
So
Rather
I
than
find for my
causing any
patients,
damage.
yeah, that's the easiest technique that I can teach them, and it's something that they can maintain.
So, Ibrahim, I wanted to discuss. So, you were a part of the ad board, the advisory board in June, and one of the key outcomes from this was that we managed to produce an algorithm for, a dentist, for our peers, colleagues to follow. How do you find that fits in with what we've been discussing today?
So I think the algorithm is something that can easily be integrated into everyday dental practice. That if you look at the algorithm itself, it fits into the questions that you would usually ask your patient, one or two tweaks here and there. But I feel that it provides almost like a protocol that help dentists. That, instead of thinking of ad hoc approaches, it really guides the approach to how
Yes.
to actually go through the steps. It minimizes the anxiety, the fears around the sensitivity, and it gives them a solid treatment plan. Okay, right, this is how we're approaching this, and we're going through it. I think it also gives the patient comfort to know that this is a recognized condition and people
Yes.
have formulated guidelines on exactly how to treat it.
So I have another question for you with regards to your endodontic background. Now, you're obviously very familiar with how we test the pulp when we do the cold test using the endo ice. Okay, so what I recall you've done a video about how we test for dentine hypersensitivity as well, right? So
Yes.
I just wanted you to give us a brief explanation. What is the difference when we're testing for dentine hypersensitivity as compared to, doing a test for pulpal sensitivity?
Sure. So this is something that I have to do very commonly in practice, because I find many patients, either via self-referral or referred from another clinician, would sometimes get dentine hypersensitivity confused with a pulpitis, with inflammation of the pulp. And really, why the instrumental screening works great for me is that, so I use the air blast in most cases and only
Yeah.
move on to the ice test after. It really comes down to the actual nerves within the pulpal area and how they respond to the stimulus. So we know that, we have our A beta or A delta fibers, those are our myelinated fibers, and give you that really rapid, quick response to the
Yeah.
sensitivity. It's there for a second or two and it goes away immediately. And I find that this helps me distinguish quite comfortably when it is just sensitivity versus when it is moving on to pulpal pathology. Because with the pulpal pathology, you then have that stimulus being there for a few more seconds, and at times it also lingers afterwards. So it helps with quite a clear-cut distinction between
Okay.
the two. Yeah.
Perfect. Thank you for that. So, following on from that, actually, I would really love it if you could share some personal experiences or cases that you've had that really highlight how you approach your patients with regards to dentine hypersensitivity and how you manage these cases.
Sure, absolutely. one case that comes to mind, and it does because it's a patient that I've been following up for quite some time, and I'll give you the background of what happened and then how we've managed this. So
Please.
it was a 46-year-old patient who was initially referred to me for chronic pain in the posterior mandibular area, that's the lower left area. And the referral, was basically the dentist was treating this patient and they just couldn't get her settled. And they thought that she possibly now required endodontic treatment, hence the referral. So, when the patient did come through and I then interviewed her, she mentioned that she had had multiple fillings on her molar teeth a few months prior, but that she still felt pain from time to time. Initially, it didn't really trouble her, but it was something that was always there. So in conversation, I also learned that she was a human resource manager from a large company, and that she was also aware of clenching her jaw often. When I further looked into that, she mentioned that she has to go to a chiropractor almost monthly to work on the muscles around the jaw, the muscles of mastication, to actually release some of that. So when we examined her, we found that there was some attrition, that was quite clear. The intraoral exam also revealed abfraction lesions, and that kind of tied in with the clenching that she was talking about. There was definitely evidence of heavy occlusion and grinding. So we went on with our usual tests, and as part of that, we do the instrumental screening, the full examination, the charting, the special investigations, the radiographs. And really, after all of that and excluding everything else, it was good old dentine hypersensitivity. And really, using that cold air blast wasn't only useful for me, it was also useful for her in that she could appreciate the exact areas where the sensitivity was coming from. It wasn't just this pain, random pain in the jaw anymore. I could pinpoint the exact teeth that she was having trouble with. So we started with our education around the condition. We covered a comprehensive oral hygiene session with her. We modified, certain aspects of her lifestyle, her diet, gave the necessary advice. But we went a step further to ask her to actually bring her toothbrush into the surgery and then demonstrate how she was brushing. So that we could then correct that for her. It was fairly funny with her being a human resource manager. She felt very managed. But I mean, it was something that she appreciated as well. We could then, at that point, it was just at the point, where I started seeing the changes with a lot of my patients with the Novamin technology, with the Sensodyne. So I did then recommend it for her to use. Like I said, I really do appreciate what bioceramics offer. And I wanted to see in her case, is this going to help her? Can it help her with the type of sensitivity she was having? So, we sent her off, we reevaluated 4 weeks later. And really, I was happy that she started reporting a reduction in her sensitivity, but at that point, she still had mild discomfort. So I thought, okay, you know what, let's escalate. Let's go on to one of our surface compounds, which we then applied onto the surfaces, and I found that was helpful to almost eradicate the sensitivity. So we said, okay, good. We at this point now. We advise her to keep using the Sensodyne, and we now follow her up. So going from 1 month, I went to 3 months just to make sure that she was fine. And now she's only coming in biannually. And really, this is just, it's a small example of how just recognizing the hypersensitivity in the first place can really change someone's lives. And like this, I can give you so many examples. Just last week, there was another patient coming through. And again, self-referral. She had gone to other dentists, wasn't sure. She actually thought she had multiple abscesses in the mouth and that she was going to require at least 4 root canals. And when I asked her, how do you know this? And she says, no, I've Googled this. I've seen what an abscess looks like.
Dr. Google. That's just scary, right?
And you won't believe she had just severe hypersensitivity across all 4 quadrants of her mouth. Again, with the instrumental screening, I could pinpoint for her. She knew then exactly where the problematic teeth were. And she's at this stage just on the Sensodyne treatment with the lifestyle modifications. And I'm seeing her again in about 2 weeks' time. And we'll see where she is. And I'm fairly confident that she would have some relief. I did say to her, if there's absolutely no relief, contact me immediately. And she hasn't contacted me yet. So yeah, small, small things
that make a huge difference. So these 2 cases that you've discussed, there's 3 things that have absolutely stood out to me and, that I feel are incredibly important. The first one is having the correct diagnosis, not rushing to say, okay, you've got this. I mean, the second example you mentioned, imagine had she gone through with someone else, they could have been doing irreversible treatment on her. And, she's potentially that much further down a treatment path that's harder to come back to. So it's so important that we have a step-by-step approach as you've outlined for us and, really make sure that we're diagnosing correctly. The other thing that stood out to me is that you mentioned the second lady who's been to different, the first one as well, actually, they've been to different people. And what makes me wonder is, and I wonder if you can elaborate on this, is are dentists communicating with each other if they are getting a case of dentine hypersensitivity and they're not realizing it? Are they happy or willing to discuss it with the colleagues? Is there communication between colleagues?
So I think that there is communication. It happens within closed and small groups. The type of communication we need is more within larger platforms so that dentists are comfortable to bring these cases forward where they do struggle with the diagnosis, so that they can appreciate also other cases that are similar where we have put into effect treatment regimens and the success of those treatment regimens. I think that will give them the satisfaction, but also the confidence that something can be as simple as dentine hypersensitivity. And by treating that, you can get the patient to becoming completely comfortable, improving their quality of life.
Thank you. And, the third thing that stood out to me, and I would say it's part of the patient journey, is the follow-ups that you've been doing. It's not a case of, okay, here you are, use this, off you go. You've called them back in, 1 month recall, 3 months recall, and then changed it to whatever you've deemed appropriate. And I think that is, A, it's good for us to see the improvement, and B, it must be, a comfort to the patient to see that their pain has been taken seriously. They're being taken care of from A to Z. They're seeing an improvement. So I think that's a great patient journey as well, for them to go through this.
Absolutely. And, that's something that has really resonated with me. In patients want to feel heard. They want to know that their concerns are being addressed. And I've had patients tell me that they felt that their doctor was being dismissive of what they were reporting. That, one of the more recent patients said to me that at one point I thought I was going mad. I thought it was all in my head because no one could find anything wrong with me. So what, what's wrong with me that I'm feeling this pain?
Yeah, I mean, not only do we have stressful lives as it is, but if you're suffering this and nobody takes you seriously or that it's being misdiagnosed, it becomes a vicious circle, right? So
absolutely.
All these elements really add up to make sure that, we have a protocol that we follow. That's where the algorithm from the ad board, I think, is hugely important. And, guys, if you're really interested in knowing about the algorithm, please visit, we've got details after the podcast. Please visit our page and have a look, download it and make sure you use it. So I think this has been an awesome episode. Thank you, Ebrahim. It's been amazing talking to you. We've dived into the multifaceted approach to managing dentine hypersensitivity. We've emphasized a step-up escalation strategy. Dr. Ebrahim's detailed an evidence-based progression, beginning with patient education and lifestyle modifications, followed by at-home treatments such as desensitizing toothpaste and fluoride rinses. If symptoms persist, in-office treatments and restorative or surgical interventions may be necessary. The science behind these strategies was explored. We shed light on mechanisms like tubule occlusion, nerve desensitization, supported by ingredients such as potassium nitrate, stannous fluoride, and calcium sodium phosphosilicate. In the discussion, we also addressed when to consider invasive versus non-invasive treatments, tying these decisions to individual patient factors such as oral hygiene habits, diet, and brushing technique. The role of electric toothbrushes, the gingival phenotype, and proper brushing methods in preventing and managing dentine hypersensitivity was emphasized. We've managed to debunk some myths as well. I think that's always a fun one to do. Highlighted the importance of professional guidance over home remedies and misconceptions about fluoride and whitening products. I think what's been amazing is discussing the real world cases. These bring insights into real life scenarios, showcasing tailored management approaches that combine education, lifestyle modification, and targeted treatments. Practical advice on correcting toothbrushing techniques and integrating effective oral hygiene regimens underscored the critical role of patient collaboration. So hopefully everyone is left with actionable knowledge on managing dentine hypersensitivity effectively. And, we've all got access to our evidence-based tools to guide our approach. So once again, Dr. Ebrahim, thank you so much for joining us from South Africa, for making this effort for us, and for highlighting your cases and your step-by-step approach. It's been absolutely brilliant. Thank you very much.
Thank you for having me. It's been a pleasure being here with you today.
Thank you. Look forward to seeing everybody on the next podcast. Bye, everyone. This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne with Novamin builds an occlusive layer from the first use that is resistant against dietary acidic challenges and maintained after repeated acidic challenges. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.